COVID-19 has come to affect our work a lot. It has negatively affected our work and engagements, especially those with community members. Usually they are very direct, one-on-one interactions with our community members. This is not happening anymore. We've had to adapt to the new guidelines and changes to the way we've been advised by our health experts. On our beneficiaries, it has affected the manner in which we've been able to interact. One major effect has been cases. We have an office that has been supporting legal and psychosocial support to our survivors, and right now that is happening virtually. What that means is that a woman in crisis is forced to make a phone call to reach a lawyer, is forced to make a phone call to reach our officers. But we've been able to adapt to that by making sure that our officers have sufficient facilitation to enable them to have that conversation, though virtually, but to be able to listen and listen keenly to the women and be able to advise them on the things that they need to do. It has affected the learning sessions that we've been having, and so right now we are adopting virtual learning platforms. So what this means is that we are having Twitter chats with our beneficiaries, we are having Facebook Live with our beneficiaries. We're also disseminating information through our website to our beneficiaries to be able to know what is happening, more about the disease, people who have questions, and also using the local media, including community radio stations, to be able to make sure as much information is available to them about what is happening. And they're also able to tell us about their own experiences from where they are and how this is affecting their lives. One of the biggest risks that we are seeing at the moment have been for survivors of violence who are now being forced to share premises with their perpetrators, especially those who are facing intimate partner violence. You're forced to sit in the same house as your abuser. And especially the risky time is the night with a curfew from 7 a.m. to 5. You're living in the same household with this person whom you're not in talking terms. The relationship is bad and they're violent. And you can't get out of the household because you're not part of the essential services and there's no one to help you. And if you call the police hotlines, they have been given instructions to focus more around the pandemic than attending to such cases. But we are aware that the police officers have been able to attend to a few of the cases that have come aboard. As the Chief Justice reported, there's been a spike in cases, especially on intimate partner violence, that have been reported to our office, from as low as 20 cases. We are now having hundreds of cases being reported to ourselves and also our partners as people who are in crisis and need support wherever they are around the country. So we are all hands-on at the moment. We've put our virtual platforms on high alerts and we've made sure they are manned throughout, that people are there to respond to any case that comes to us.